In this video, we will cover oral inhalants, such as a metered dose inhaler, a discus inhaler, as well as nebulizer machines and nebulizer solution. Moving on to metered dose inhalers, you want to make sure you're washing your hands for at least 20 seconds. And then you're going to explain all of the steps to using this inhaler to your resident. So make sure that you have the unit assembled after inspecting the mouthpiece. You're going to shake that medication canister inside the mouthpiece, and then have that resident exhale fully, and then they're going to place the mouthpiece either in front of their mouth or in their mouth with their lips wrapped around, however it is designated in the manufacturer's recommendations. And then while inhaling again slowly and deeply through their mouth, you're going to depress that canister fully. Have the resident hold their breath for 10 seconds or as long as possible. And then exhale slowly through pursed lips. And the point of pursing the lips is to ensure it is a slow, controlled exhale. Here is a pictogram to be able to just give you a better idea of the timing and how that works. So the top picture being with a spacer and the bottom being without a spacer. For a discus, it is slightly different. There's no shaking of the item, as well as it is kept parallel to the ground. It doesn't have a separate canister and mouthpiece. You still want to inspect that mouthpiece and ensure nothing's cracked or that nothing has gone inside of it. But it's not a separate item like the metered dose inhaler is. But it's administered in the same way, in the sense that the resident is going to breathe out, breathe in deeply through the inhaler, hold their breath, and then slowly breathe out through pursed lips. If you have a resident that is using the Spiriva HandyHaler, you're going to make sure that you're wearing gloves because you will be touching the medication. Open it up from the foil packet that the pill is in. And a side note, this pill is only to be used inside of the HandyHaler device. You are not to have the resident swallow the capsule. So moving forward, you're going to place that pill inside of the HandyHaler, pierce it. So that's going to be done by the second image, which is pushing the side button. That's going to pierce the capsule. And then the resident is going to place the mouthpiece on their lips, breathe in, and then exhale, and then they're going to breathe in again. Do not have them exhale into the device. Make sure that they're removing it from their mouth before they exhale to inhale a second time. And by inhaling that second time, you're just ensuring that all of the contents of that capsule have been inhaled properly. For oral inhalers as a whole, you want to make sure that you're waiting 1 full minute between puffs of the same medication. If you have different medications, such as that albuterol metered dose inhaler and a corticosteroid inhaler such as Advair, you want to wait 5 minutes between doses. So you're also going to use sequential inhalers in accordance with the doctor's orders. And you always want to make sure that you're using a bronchodilator before any steroids or other type of inhalers, if there are more than one type for that particular resident. If a corticosteroid is used, make sure that that resident is rinsing out their mouth to avoid any possibility of thrush. A nebulizer is another way to administer inhaled medications. This is done by a nebulizer machine that vaporizes the medication for that resident to inhale over a longer period of time. If at all possible, these should be done in private within the resident's room. Make sure that you are measuring the correct amount of medication and putting that into the medication cup. Typically, it is just one entire ampule or little plastic vial that this medication comes in. However, ensure that you're reading the directions on that prescription label from the doctor in the event you need to either mix that with another medication, or if you need to dilute it, that you have that correct medication. You're going to connect all of the pieces, so that's going to be the tubing into the bottom of the medication cup and connecting that to the nebulizer machine, and then connecting the mouthpiece or the mask on top of the medication cup. You're going to either put that mask around the patient's nose and mouth, or you're going to instruct them to place the mouthpiece in their mouth with their lips around it. And then they're going to just take slow, deep breaths in and through their mouth. Continue to observe that resident. It'll take about 15 minutes before all of the medication is gone from that medication cup. Once it's done, have the resident rinse their mouth and then rinse the equipment. Recommended cleaning is that you soak the parts for 1 hour in a solution of equal parts vinegar and warm water weekly, and then rinse it well and allow it to air dry.